and
Good
today's
afternoon.
good afternoon and everyone, and today's lecture is protein synthesis inhibitors. And protein synthesis inhibitors selectively inhibit uh, subunits of the bacterial ribosome, because the size of the ribosome is different from the mammalian ribosome. And the tetracyclines uh, are the uh, one of the main groups that are used uh, for the treatment of the infection, and they are composed of 4 rings fused together, and they have different uh, residues around these rings, and depending on that they will have different pharmacokinetics, and also the antibacterial spectrum. And most commonly used tetracyclines include doxycycline and tetracycline, and then also demeclocycline and minocycline are used seldom. The antibacterials, so the mechanism of action of the tetracyclines is actually based on the inhibition of the uh, attachment of the MAD transport RNA to the mitochondrial RNA as 30 subunit. So actually this is a transport RNA, and this is matrix RNA, and that tetracyclines inhibit this attachment, and that leads to the inhibition of the protein synthesis. The antibacterial spectrum of the tetracyclines include the gram-positive and gram-negative microorganisms, as well as an anaerobic, some of anaerobic spirochetes, Mycoplasma, Chlamydia, and also Rickettsia. So the most commonly used indication is the pneumonia, and so pneumonia is usually the community acquired pneumonia that is developed by the Streptococcus pneumonia, and so this is the most common indication. And then also the cholera is the next common disease that can be seen in developing countries, and also in those villages where the hygiene is low. And unfortunately there were a cholera outbreak in Kazan about 15 years ago. So, and that is very rare case because usually cholera is not seen in cities, especially big cities like Kazan, like about 2 million people here, and also uh, the, there are many hospitals and many outpatient clinics. However, there was a cholera outbreak, and when I was at school, so uh, we visited the river, and we swam in the river where the cholera outbreak uh, uh, was from. So, and further after that, after this outbreak, they uh, uh, so they actually destroyed the river by putting some scent to it, and then actually it disappeared. And the disease is also, the outbreak was gone because the epidemiologist just asked the city authorities to actually prevent access to the cholera source, that was a lake, sorry, the river. And so cholera is actually a GI disease, so, and then multiplies in the GI system, and then produces diarrhea, and the treatment is doxycycline, and actually a fluid replacement in those patients that are very bad, very sick. So then also the Lyme disease is also treated with the tetracyclines, and Lyme disease is a spirochetal infection, and the bacteria is Borrelia burgdorferi, and the disease is transmitted by the bite of the ticks. So it's tick-borne disease, and usually these ticks will bite when a group of people will go for the camping in the woods, and so they bite actually at the open skin. So that is why if you go to the woods, then it's better to cover to wear a long sleeves and also cover the skin, or use a special sprays for against the mosquitoes and also the insects. So the infection is very severe and will lead to the meningoencephalitis and then arthritis, and characteristic pattern is seen on the skin with the erythema, and that is a hallmark of the Lyme disease, and doxycycline again is used for the treatment. I think we've seen, no, it's not here. So then there is a atypical pneumonia, that is Mycoplasma pneumonia, that is actually the common cause of the community-acquired pneumonia in young adults, especially in military camps, and some in those places where people are very crowded, and treatment is also with a doxycycline. Then there are Chlamydia infections, that is the sexually transmitted disease, and that will lead to the urinary infections. The infection is very inflammatorious and also leads to the lymphogranuloma, and then also doxycycline or azithromycin. Azithromycin is not a tetracycline, but is also effective for the chlamydia. So, but doxycycline actually is also effective. So, and also the rickettsia is a very rare disease caused by the Rickettsia rickettsii, is the will lead to the fever and bone disease and joint disease, and actually doxycycline is also used for the treatment, but the treatment should be started early in the disease, because later it can be fatal. So these are the antibiotic spectrum of the tetracyclines. So, and most commonly tetracycline that is used is the doxycycline. So, and also doxycycline can be used for the treatment of the acne, and also most common indication is chlamydia infections. Uh, so the pharmacokinetics is actually easy, like both doxycycline and minocycline are passing to the uh, through meninges, so they can be seen in the cerebral spinal fluid, and doxycycline actually uh, can be taken orally or intravenously and intramuscularly, and it's excreted. So doxycycline is excreted by the bile, but other tetracyclines are excreted in the urine. So adverse effects include epigastric distress that is commonly seen, especially if taken with a milk, so or with a food with that is rich with the two valent ions like the iron or aluminium, so any irons. So actually this is the um, concentration of the tetracycline that is taken on empty stomach, that is normal concentration, and then there is actually a decrease in the concentration because of the absorption is disrupted with the aluminum antacid, and aluminum is covalently binded with the tetracyclines as well as other ions like the iron, magnesium, and calcium, and that is why the tetracyclines are precipitated in the stomach and will lead to the GI disturbances, and the absorption will be decreased. So the bioavailability will be lower. The basic bioavailability is low, is like for the tetracyclines only 40%, and can be further decreased with milk or with aluminum, calcium, iron products. So, and some patients even complain of the GI disturbances, and then they buy uh, uh, like the antacidic medications for the treatment of the uh, GI, and that further decreases the absorption and then makes the adverse effects more severe. So then also besides the GI disturbances, the tetracyclines are deposited in the bones and teeth. That is why contraindicated in children up to the age of 21. So the tablets are contraindicated up to the age of 14. The ointments are contraindicated up to the age of the 21. Then liver failure and phototoxicity are common. In case of the phototoxicity, it's recommended, so it's the antibiotic should be stopped because phototoxicity leads to the burns of the skin, and also those patients that are on tetracycline and doxycycline are recommended to use sunscreen and avoid direct sun exposure. Then vertigo and avoidance in pregnancy because of the deposition in the bones. That is why pregnant women and breastfeeding women should not use tetracyclines because they will lead to the bones will be prone to the breakage. And then So breastfeeding women and pregnant women should avoid tetracyclines. So then also so the next group is aminoglycosides. So and this is a so actually aminoglycosides include the gentamicin and streptomycin, and also neomycin, amikacin, and tobramycin. The mechanism of action of aminoglycosides is also they bind the S30 subunit, and they disrupt the reading of the matrix RNA, so that lead to the errors in the protein, so the protein is not working. So also S30 subunit, but a little bit different mechanism, and the antibiotic spectrum include gram-positive and gram-negative microorganisms. So for the gram-positive cocci, they can be used for the Streptococcus and Enterococcus, and they usually can be combined with the beta-lactam antibiotics to increase the effectiveness. And then for the gram-negative antibiotics, they cover the Tularemia, that is rabbit disease, that is transmitted by the rabbit, and usually seen during the hunting season, because the hunters will obtain disease from the rabbit while skinning them when butchering them, and then the Tularemia will lead to the pneumonia, and gentamicin can be used for the treatment. And also the Pseudomonas aeruginosa infections, that can be any disease, like the also pneumonia, or any skin disease, or any organ disease. So this is the antibiotic spectrum. Then the pharmacokinetics include most of the aminoglycosides are injected intramuscularly, intravenously, or intrathecally. So they don't pass the central nervous system, but can be injected directly to the central nervous system intrathecally. And there is no oral way available, so because they are not absorbed orally, and all of them are injected parenterally, except of the neomycin, because neomycin is toxic, only used topically. Because neomycin has a nephrotoxicity and only used topically for skin infections, and it also used orally for the bowel preparation prior to surgery of the bowel. So those drugs that are injected parenterally are excreted by urine. So and actually they distribute well to the highly polar volumes, so but not to the central nervous system. um, but they cross the placenta barrier and can accumulate in the fetus. That is why uh, they should not be used in pregnant women. Adverse effects include ototoxicity, that is can be not reversible, and that is why should not be combined with the other drug that lead to the ototoxicity. Then also nephrotoxicity, uh, paralysis, neuromuscular paralysis. Uh, so especially in those patients with a high concentration, uh, and uh, to help patients, we can administer calcium gluconate or neostigmine, that is a uh, acetylcholinesterase inhibitor. That is a antidote for the neuromuscular block. And then also contact dermatitis is very common, especially for the neomycin that is applied topically. The next group is macrolides, and macrolides are actually our most expensive antibiotics in this group, especially clarithromycin and azithromycin. But erythromycin and telithromycin are also older ones, but still can be used for most of the same indications like other clarithromycin and uh, erythromycin. Clarithromycin and azithromycin. So the spectrum of activity includes the gram-positive, negative, spirochetes, Mycoplasma, Chlamydia, and also Mycobacterium avium complex that is very rare, only in AIDS usually. So actually the Streptococcus pneumonia is also covered, and then diphtheria. Diphtheria can be used uh, so in those patients who are allergic to penicillin and other beta-lactam antibiotics, erythromycin is the replacement treatment for the diphtheria. And then Neisseria gonorrhea leads to the gonorrhea, and this is gram-negative. And then also the Legionella. So this Bordella pertussis, Campylobacter jurgensi, and Haemophilus influenza actually common gram-negative diseases are also covered by the beta-lactam antibiotics. But Legionella pneumophila is the disease that is very uh, uh, dangerous because it leads to the death, and is actually can be asymptomatic. So, and usually the azithromycin is used for the treatment, uh, and actually this is a central nervous system infection. And then the Treponema pallidum, that is the syphilis. So sexually transmitted disease. Mycoplasma pneumonia is atypical pneumonia, and also Uraplasma ouralyticum, that is a urinary tract infection disease, and azithromycin is also effective. And Mycoplasma pneumonia can be also treated by the doxycycline, just so they are equally effective. And that chlamydia infections, also azithromycin is effective. And Mycobacterium avium complex is usually is a very complex disease that is treated with a combination with a rifampin and ethambutol. Uh, and also for the prophylaxis, azithromycin is used in patients with AIDS. or HIV. So actually, HIV for HIV patients. So, but AIDS actually more severe uh, patients, severe state of the HIV patients, and actually that is why it requires the prophylaxis prescription of the antibiotics. Then the pharmacokinetics is like they all don't penetrate to the central nervous system, and the erythromycin should be administered intravenously because it's destroyed by the gastric acid, or can be anticoated tablets. Can be administered orally. The clarithromycin, azithromycin, and erythromycin are stable in stomach acid and absorb better, but food will interfere with absorption of erythromycin and azithromycin, but not with the clarithromycin. That is why clarithromycin is more expensive, and also erythromycin and azithromycin are available as for intravenous injection. All eliminated by the bile except of the clarithromycin, that is eliminated by the urine. So adverse effects include GI disturbances, jaundice, and ototoxicity, so the same as the previous group. So and contraindications include the patients with the liver disease, and also some of them may prolong the QT interval and lead to the arrhythmias. Okay, I think that is all for today. So if you have some questions or comments, then feel free to leave them below, and thank you for your attention.